Hi, I'm Peter Pronovost, the Johns Hopkins Medicine Senior Vice President for Patient Safety and Quality and the Director of the Armstrong Institute. One of the most important ways you can keep yourself safe in caring for patients with Ebola is to make sure that you learn to put on and take off personal protective equipment in the most appropriate way. Now, the Centers for Disease Control has provided us detailed guidance for how to do that, but we needed training modules. So we partnered with the CDC to do that. We pulled together our infectious disease experts, human factors and systems engineers, psychologists, instructional designers, and technology experts to come together to produce this content. We've been here a week, working long hours to make modules for you. And now what you will see are 3 key modules. Number 1, how to put on or don personal protective equipment. Number 2, how to take off or doff personal protective equipment. And number 3, how the observer can work together to help ensure your safety using teamwork behaviors that were developed by the Agency for Healthcare Research and Quality. Now, we know these are anxiety-filled times. Believe me, I'm a critical care physician. I'm right with you. But we also know that with proper training and when we ensure your competency in putting on and taking off this equipment, we could safely care for these patients. So we hope you enjoy the training, and from our colleagues at the Centers for Disease Control and our colleagues at Johns Hopkins Medicine, we thank you for all you do for patients.
This training module discusses the roles and responsibilities of trained donning and doffing observers, called trained observers. A trained observer is a clinician, most likely an infection prevention professional, nurse, or physician, whose sole responsibility is to guide healthcare providers as they don and doff personal protective equipment, or PPE. When acting as a trained observer, you will not be delivering care directly to patients. Instead, you will focus on ensuring the safety of healthcare providers and, in some circumstances, their doffing assistants. You may directly assist your care delivery colleagues as they don their personal protective equipment. You will need to walk through the care processes and equipment usage patterns of your institution to understand if and when a doffing assistant is required. If your institution determines that there are circumstances where you, as the observer, will also offer doffing assistance, you should strictly minimize direct physical contact. When you work with a healthcare provider and doffing assistant, you will not assist at all. You are a proactive risk monitor, protector, and guide who calmly leads healthcare providers through the routine aspects of donning and doffing personal protective equipment. Remember, an effective observer is vigilant in spotting breaches, is proactive in identifying upcoming risks, uses the checklist but focuses on the big picture, is informative, supportive, and well-paced in issuing instructions or advice, always washes immediately after providing assistance. The broader goal is to minimize the amount of direct contact assistance you provide. If you do provide assistance in doffing, remember always to disinfect your gloves. This hand hygiene step must be followed every time you touch possibly contaminated equipment. Hand hygiene is time-consuming, but is critical for safety and a good method of pacing the doffing process.